Yeah, so today I'm going to talk to you about the challenges of applying AI in HIV and also infectious diseases. So I thought as the first speaker of the afternoon session, it would be interesting to first give you a few pointers on what are some of the potential applications of AI in HIV and STI care before I move on to the challenges and risks in those 4 buckets. So how can AI help to accelerate progress against HIV and STI, right? I'm sure all of you here are familiar with the UNAIDS target, so I will not delve into that. But although much progress has been made in this area, there's a need for continued innovation to accelerate the progress, and emerging tools such as AI can be leveraged as one of the tools to help accelerate this progress. Just to give you a sense of where the AI market is now, with these statistics from, I think, 2021, the global AI in HIV and AIDS market is expected to grow at an annual rate of 8.9% from 2022 to 2030. And back in 2021, North America held the highest industry shares, and I won't be surprised if they are still holding the highest industry shares in the market now. And APAC is anticipated to have the highest growth rate, probably because of the contribution from countries such as China, Japan, Korea, and India. So what are some of the potential applications of AI in HIV and STI care, right? Firstly, in the realm of targeted prevention, machine learning and also natural language processing can help to analyze large data sets to identify high-risk populations for various interventions such as PrEP use. And the use of geographical location data can also be used for geospatial mapping and cluster detection for HIV transmission. So I quoted a real-world example here with this study done by Marcus and team. They utilized electronic health record data from a large population in Northern California to develop this predictive model to identify high-risk populations for PrEP use. And what they found was by incorporating this rich EHR data, it significantly improved the identification of potential PrEP candidates as compared to simpler models that only took into consideration history of STIs. So by rich EHR data here, on top of incorporating clinical data, they also put in important factors such as social demographic factors and more on the individual level kind of data, which to me is as important as clinical data when it comes to this kind of prediction models in HIV care. Yeah, and the second area is in early detection. So AI algorithms can help to analyze complex patient data for early diagnosis. And through the use of chatbots and AI applications, it can help to improve access to HIV education and counseling. And the access is improved because it can overcome geographical barriers, right, and resource constraints in a sense. But here, I want to highlight that we are also aware of the potential of AI technologies widening the digital divide, right? But with proper and ethical and responsible use of AI, we can leverage the good side of AI to help to overcome some of these barriers to testing, to HIV status disclosure and linkage to care, especially since HIV is still a very much stigmatized topic in a lot of countries. With this study with Chia and team, right, in Malaysia, you can see that they used AI chatbot to promote HIV testing and PrEP use among MSM in Malaysia. And what they found is that majority of the participants found the chatbot useful in providing comprehensive information, and it also helped to avoid stigma-inducing interactions, which potentially increase the HIV testing frequency. And then lastly, in optimizing treatment and adherence, machine learning can analyze patient data to recommend personalized ART regimens. So regimens that are stage-specific, they are adaptive. As the virus evolves with the treatment, machine learning can help to create more personalized treatment methods for more effectiveness. And also AI-based chatbots and apps can help to improve medication adherence by providing counseling and also support. Particularly important is the emotional support that it can offer. And NLP can also be used to develop predictive models for retention in HIV care. And AI models can help to accelerate HIV drug discovery and development. So the example I quoted here is this prediction system called Yi-Resist, which is an online tool that uses ML to analyze patient data, things such as treatment history, CD4 counts, to predict the most effective AI regimen for the patients. Okay, so moving on to the actual topic of the talk, which is on challenges and risks. I've categorized them into 4 buckets, mainly data, ethical, implementation, and regulatory. So for data challenges, I'm sure this is not new to most of you because data challenges have been around for a long time, and we heard from the earlier session also some of this risk of data privacy, right, and security breaches, especially when dealing with health data, which are sensitive, and particularly in HIV, the stigma surrounding the topic also. And as most of you might know, we always say AI models are only as good as the data you input into the model. So if there's an absence of quality data, then the output of the model will not be optimal. Yeah, so not just quality data that we are talking about here, it's also diverse and representative data, right? Especially in the communities that the AI technology will eventually be deployed. We want the data to be representative of the local communities so that the output is optimized for the local communities. And there's, of course, this risk of AI models perpetuating existing biases and inequities. One of the main reasons is because, the lack of quality data in certain populations, in certain communities, simply because the technology is not there, right? They might even be in the paper and pen format when it comes to health data. They don't even have digitization of health data in that sense. And the capacity to develop AI models is also lacking. So a lot of times, AI models are developed in one country and adapted for use in another country, but without proper training and validation using the local data sets, right? So this lack of contextual specificity also brings a problem to the output or to the recommendation that the AI models brings. And lastly, the data silos and the lack of interoperability between the e-health systems. And moving on to the ethical challenges, as most people talk about AI as black boxes, it's because most people know what goes into an AI model, what comes out of the AI models, but they do not know what happens in between, right? Or rather, they do not understand what goes on in between because of the complexity of AI models. It's not that easy to explain to non-technical people to understand the workings of an AI model. So this lack of transparency and also explainability of AI models is one of the main ethical challenges discussed out there. And also liability and accountability issues with AI models. So for example, imagine a clinician using an AI-driven system to help in diagnosis, but in the end there is an error with the diagnosis. So who should be held accountable or liable for this kind of situation, and what are some of the legal implications of using AI in health? And then there's the systemic bias and inequalities, which I've talked about just now when I was talking about data challenges. So we do not want the data to be biased, which will result in biased AI algorithms and outputs. And of course, the widening of the digital divide is something we should be mindful of all the time. And then moving on to the implementation challenges, right? A lot of these are actually correlated to the ethical challenges or some of the earlier challenges that I've talked about. For example, the lack of transparency in the AI models do lead to the lack of trust and also acceptance, which eventually hinders adoption. And this is that translational gap, right, between developers and end users, because it is hard to pass on that knowledge from developers to end users to get people to understand AI model and to trust AI models when using them. And there's also a lack of strong clinical evidence to show effectiveness. So there is an ongoing debate on whether, randomized controlled trial is still the gold standard when it comes to the testing of clinical evidence and effectiveness of AI models, right? Firstly, because AI models evolve at such a fast pace, right? They adapt, they learn as new data comes in. And RCT, by its nature, will probably take months or even years to conduct, right? So by the time the RCT is completed, probably the AI model in question is already outdated or doesn't really apply to the real-world setting anymore. And also because of the adaptive nature of AI models, it's also hard to match it to the more rigid nature of RCT. So there are a lot of discussions on alternative validation mechanisms, things like sandboxes, things like more pragmatic trials, where we can really see AI in working, right, in the real world setting. And then the second implementation challenge is in difficulty integrating AI tools into existing clinical workflows. So last year, or I think 2 years ago, we did this study in Singapore and also in India, where we asked clinicians about their perspective when it comes to using an AI-driven clinical decision support tool for antibiotic prescription. And actually, surprisingly, the findings in both of these countries are quite similar. A majority of them are resistant to change in a way because they do not, it goes back to the point that they do not understand how the AI model works. And there's this lack of trust with the AI models. And also one more point on them having insufficient digital workforce development, meaning they do not have the capacity or they do not have the training to have the knowledge and skills and even the confidence to integrate AI tools into their daily workflows, right? And the last point is a very fundamental, basic point where there's just limited computational resources and infrastructure in a lot of the countries. And thus, us being mindful of the digital divide, right, between the countries. And then moving on to the last bucket, which is the regulatory challenges. This is actually the heart of what we do at HealthAI. We work with countries to identify regulatory challenges and how can we help them overcome some of these challenges. So these are some of the few key points that we learned while talking to the governments and regulators around the world. So not just with LMICs, but also with HIC, we see some of these points emerging. So the first one is the lack of comprehensive regulations specifically for AI in health. So currently there are, most countries have hard laws or guidelines for AI in general. So this horizontal oversight of AI, right? But when it comes to the vertical domain in health, there is a lack of comprehensive regulations. So for example, the fresh off the press EU AI Act, which is enacted, they have health provisions, but it's not specifically discussed and enacted for AI in health. So another challenge is keeping up with the rapid pace of AI innovations, right? Because hard laws, as you know, take a long time to enact, take a long time to discuss, and they are very rigid in the sense that if you want to make amendments to it, it will probably take another whole process. So how do we keep up with the rapid pace of AI innovations and ensure responsible AI without stifling some of the AI innovations? And then the second point is on challenges in post-market surveillance, right? Because AI algorithms are very adaptive, like I said just now. After the initial approval from regulatory departments of the AI applications or algorithms, there might be multiple iterations, multiple versions of the AI model. So how do we ensure that there is post-market surveillance, and how do we ensure that subsequent versions of the AI models are still complying with the regulatory requirements? And the third point is on navigating multiple regulatory layers. This is unique to AI in health because for AI in health, you need to not just comply with AI laws in general, right? You need to comply with medical laws, which includes medical device regulations or health services regulations. And because data is involved, we also need to comply with data regulations. So there are multiple layers that you need to work with. And from what we are hearing from developers, right, they find it very challenging or rather confusing to navigate this process because there are just so much paperwork and processes to go through so the question is then how do we synergize some of these processes, right, so that we, while ensuring responsible AI in health, we do not complicate the process so much that, it makes it very hard for developers to bring their products to market. And then because different countries are working in silos or in different pace, there is a fragmented space around the regulatory framework now. And of course, there is insufficient regulatory knowledge and capacity among regulators and developers in different countries. So all countries are moving at a different pace. So how do we ensure that we do not leave anyone behind, right? And how do we really think ahead of the curve on how to help certain countries set up regulatory requirements? So in conclusion, AI undoubtedly holds great promise in improving HIV and STI care, but collaborative effort is needed to ensure responsible AI for more equitable and effective HIV and STI care for all. So the key word I want to highlight here is collaborative effort, right? So there needs to be a conversation, there needs to be voices from diverse stakeholders, and this includes, so not just governments, regulators, and developers. Communities need to be involved. There needs to be voices from patients, civil society groups. So for all to come together and from the start, right? Not just when we have already come up with all regulations and when the AI tool is going to be deployed to the community, then we start engaging the communities. So it is a collaborative effort from the start of the process all the way through the entire spectrum. Which will address some of these challenges. So just in conclusion, there needs to be robust governance frameworks and comprehensive ethical safeguards. But at the same time, we do not want to make too stringent regulations so as to stifle AI innovation, right? And there needs to be continuous post-market monitoring and evaluation and harmonization also of regulatory approaches and frameworks. And last but not least, of course, is capacity strengthening of the teams in different countries and also of developers and users. Thank you so much.